Hello and welcome to Bite-Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on bacterial classification, Staphylococci and Streptococci.
So now let's try a question. Which of the following features is characteristic of gram-negative bacteria compared to gram-positive bacteria? So our options are a thick peptidoglycan layer, presence of teichoic acids, absence of an outer membrane, production of both exo and endotoxins, and a higher susceptibility to antibiotics due to cell wall structure. So you will remember from our table earlier that the correct answer here is D. Gram-negative bacteria produce both exo and endotoxins, whereas gram-positive bacteria only produce exotoxins. So now let's try a question, taking all of that together. A laboratory technician is performing a bacterial identification test on a sample from a patient with a suspected streptococcal throat infection. The bacteria isolated from the sample are gram-positive cocci that are arranged in chains. Further tests reveal that the bacteria agglutinate with antiserum specific for the Lancefield group A carbohydrate antigen. Which of the following is the most likely identity of the bacteria? So I'll just give you a second to read that again. We've got a few clues within this rather long vignette. So we've got someone with a streptococcal throat infection. They are gram-positive cocci arranged in chains. And we know that they agglutinate with antiserum specific for Lancefield group A. So these are the options. Our options are Streptococcus pneumonia, Streptococcus pyogenes, Staphylococcus aureus, Enterococcus faecalis, and Neisseria meningitidis. Now, the question talks about Lancefield grouping, so we know immediately it must be a Streptococcus species. And you may remember from a previous slide that Streptococcus pyogenes is the bacteria which causes strep throat and is also classed as Lancefield group A. And therefore this is the correct answer. So let's now try a question. A 55-year-old man with diabetes mellitus presents to the clinic with a 2-week history of pain and swelling in his left foot. He has a history of poorly controlled blood glucose levels and peripheral neuropathy. On examination, there is erythema, warmth, and tenderness over the metatarsal area. Radiographs of the foot reveal bone erosion and periosteal reaction, consistent with osteomyelitis. Blood cultures are drawn, and the results identify Staphylococcus aureus as the causative agent. Which of the following is the most likely route of infection in this patient? So these are your options. Hematogenous spread, direct inoculation, contiguous spread from a nearby soft tissue infection, spread from a distant cutaneous source, or translocation from the gastrointestinal tract. So you might wish to pause the video at this point and look back at the vignette, just to remind yourself of the history. But as we've been told, this gentleman does have a history of poorly controlled diabetes and peripheral neuropathy, and he's also got an area of erythema and warmth over the metatarsal area. So this makes it most likely that the osteomyelitis has come from contiguous spread from a nearby soft tissue infection, and so the correct answer in this case is C.
Let's do a question. A 72-year-old man with a history of chronic obstructive pulmonary disease or COPD is admitted to hospital with a severe skin infection. He has a history of multiple hospital admissions in the past year. A wound swab grows Staphylococcus aureus resistant to methicillin or MRSA. Which of the following is the most appropriate initial treatment for this infection? A. Penicillin V, B. Flucloxacillin, C. Vancomycin, D. amoxicillin with calvinolic acid, E. ciprofloxacin. So if you recall, we discussed this in this session, that at least the initial treatment suitable for MRSA is going to be option C, which is vancomycin.
So let's now try a question. A 3-year-old boy is brought to the emergency department with a 2-day history of fever and irritability, followed by the abrupt onset of diffuse erythema and tender skin. Within hours, large bulli form and the top layer of the skin begins to peel off in sheets, particularly around the diaper area and axillary regions. The child appears dehydrated and is in considerable pain. There is no mucosal involvement noted on examination. A diagnosis of staphylococcal scalded skin syndrome, or SSSS, is considered. Which of the following best describes the pathogenesis of this condition? So these are the options. So option A is direct invasion and destruction of skin cells by Staphylococcus aureus. Option B is immune-mediated vasculitis triggered by Staphylococcus aureus infection. Option C is the formation of immune complexes in the skin following Staphylococcus aureus infection. Option D is production and systemic distribution of exfoliative toxins by Staphylococcus aureus. And E is activation of the complement system leading to the skin blistering and peeling. So you may wish to pause the video at this point and go back to the previous slide to look at the vignette. So as we can see, there is a diagnosis here of scalded skin syndrome in a child, which you may recall is secondary to the production of exfoliative toxin. So in this case, the correct answer is option D.
Let's do a question. A 68-year-old man with a history of type 2 diabetes undergoes placement of prosthetic hip joint 6 weeks post-operatively. He presents with a low-grade fever and mild pain around the site of the surgery. His white blood cell count is slightly elevated and the radiographs of the hip shows no signs of fracture or dislocation. Blood cultures are drawn and after 48 hours of incubation, they grow gram-positive cocci in clusters, which are identified as coagulase negative. The organism is most likely resistant to methicillin. Which of the following features is most characteristics of the organism causing the patient's symptoms? The options are A. Production of exfoliative toxins, B. Ability to form biofilms on prosthetic devices, C. Hemolytic activity on blood agar, D. Production of enterotoxins leading to food poisoning, E. Superantigen-mediated activation of T cells. So this is actually a question that is designed to test 2 abilities, and it's got 2 stages. First, it asks you to essentially identify the appropriate bacteria with the information that's given to you. And second, after that initial identification, you are required to see which of these is correct. Hopefully, after listening to today's section, you will all realize that this is a case of staph epidermidis, especially in the case of an implant. Therefore, the correct option is going to be option B, which is the ability to form biofilms on prosthetic devices.
Here's an example of a typical question you might see on this organism. So a 23-year-old woman presents to her general practitioner with dysuria, increased frequency of urination, and suprapubic pain. She reports no fever or flank pain. Her medical history is unremarkable and she is sexually active. Urine analysis reveals pyuria and bacteriuria, but no hematuria. A urine culture grows gram-positive cocci that are resistant to novabiocin. Based on the most likely causative organism, which of the following is the best initial antibiotic choice for treatment? So our options are amoxicillin, vancomycin, trimethoprim, ciprofloxacin, or erythromycin. So you'll remember from earlier in this episode, the correct answer here is most likely trimethoprim.
Let's do a question. A 10-year-old boy presents with a sore throat, fever, and tender anterior cervical lymphadenopathy. On examination, his tonsils are erythematous and covered with exudate. A rapid antigen detection test for a Streptococcus pyogenes is positive. Which of the following complications is most directly associated with the untreated infection by this organism? A. Hemolytic uremic syndrome or HUS. B. Acute rheumatic fever. C. Pertussis. D. Diphtheria. E. Acute glomerulonephritis. So if you want to pause your video and have a think about what we've discussed today. So the correct option is going to be acute rheumatic fever. As you recall, Streptococcus pyogenes is not really associated with pertussis, diphtheria, or indeed hemolytic uremic syndrome. It is associated with glomerulonephritis, however, this is not the acute type, and this is the chronic type, which manifests as a post-Streptococcus glomerulonephritis approximately 2 weeks after the initial infection. Therefore, even if you're not familiar with this bacteria causing acute rheumatic fever, by the process of elimination, you should be able to get to the correct option, which is going to be option B.
So, based on everything we've learnt, let's try a question. A pregnant woman at 36 weeks of gestation is found to be colonised with Streptococcus agalactae or Group B Streptococcus during routine screening. She has no known drug allergies. Which of the following is the most appropriate management to prevent neonatal Group B strep disease? So these are our options. Firstly, administer intrapartum prophylaxis with intravenous erythromycin. B. Administer intrapartum prophylaxis with intravenous penicillin G. C. Treat with oral amoxicillin until delivery. D. No action is required unless the baby shows signs of infection post-delivery. Or E. Administer a single dose of intramuscular ceftriaxone to the mother immediately. So, thinking back to the video, you'll recall that the correct answer here is B. Administer intrapartum prophylaxis with intravenous penicillin G. It's not good enough to wait until the baby is born or until the baby shows signs of infection, as this can be quite a dangerous infection in neonates, so it's best to give prophylaxis to the mother prior to delivery.
Let's do a question. A 70-year-old man with chronic obstructive pulmonary disease or COPD presents to the emergency department with a 2-day history of fever, productive cough with purulent sputum, and pleuritic chest pain. A chest X-ray reveals low wall consolidation. Blood cultures are drawn and sputum cultures grow gram-positive diplococci that are optogene sensitive and bile soluble. Which of the following is the most appropriate initial antibiotic treatment for this patient? So your options are A. Intravenous vancomycin. B. Oral azithromycin. C. Oral amoxicillin. D. Intravenous gentamicin. E. Oral doxycycline. So if you recall, you will remember that this patient is most commonly having pneumonia, and pneumonia is commonly caused by strep pneumonia in the UK, and therefore the patient should receive a penicillin-based antibiotic at the first instance. Therefore, automatically, your options of A, B, D, and E are incorrect. And option C, which is the oral amoxicillin, is the correct option. You may say that you were going for an intravenous choice. However, looking at the vignette, it doesn't actually tell you how unwell the patient is. Therefore, you could realistically supply them with an oral antibiotic if they are well enough, depending on their KERP score. If you want a refresher of community-acquired pneumonia and calculation of KERP score, please click here to revisit our video on that topic.
So now let's try a question on this topic. A 45-year-old man with a history of mitral valve prolapse presents with fever, malaise, and a new heart murmur. His dental history reveals he underwent a dental extraction 2 weeks prior without antibiotic prophylaxis. Blood cultures are positive for gram-positive cocci in chains that do not lyse red blood cells in the presence of bile, but do produce a greenish discoloration on blood agar. Which of the following is the most likely diagnosis? So our options are acute rheumatic fever, infective endocarditis caused by Streptococcus viridans, infective endocarditis caused by Staphylococcus aureus, acute pericarditis, or myocardial infarction. So we have a few clues in this vignette which can point us towards the correct answer. We have a gentleman who has a history of valvular damage with mitral valve prolapse, and he's presenting with what sounds like infective symptoms, and he also has a new heart murmur. He's also had recent dental surgery, and as we have heard, Strep viridans is a commensal bacteria within the mouth and can lead to dental infections as well as endocarditis. We also have some investigations given to us which show that the bacteria is a gram-positive coccus, which grows in chains, and it is bile insoluble. So the correct answer here is infective endocarditis caused by Streptococcus viridans.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.